what are some of the rehabilitation therapies that might help you practice? What are some of the things that you always want to be able to do to try to get better? So let's talk about that a little bit. To begin with, I always think, and experts in the field believe very strongly now, that task-oriented practice is most important. In other words, it doesn't pay to just sit there and try to open and close your hand, or try to lift your arm up or reach. What you want to do is reach for items that are important to you, that you want to use. It doesn't pay to just stand in place or try to take a few steps. Think about being goal-oriented. Where do you want to get to? You want to get to your kitchen. You want to get to the refrigerator. You want to get in and out of the bathroom. And you practice doing these things, as we were saying, over and over again, trying to get better at it. So if you want to be able to improve in using your affected hand, and you have some ability to extend your wrist and open and close your hand, what you're going to have to do is spend a lot of time working on that, reaching for items. So this is sometimes called constraint-induced movement therapy. One way of making sure you use that hand is to take your unaffected hand, put it in your pocket, or put a mitten on it, and just try to spend your day only using that affected hand. Now, of course, you have to have fair control, motor control, and movement of that hand to be able to do that. Otherwise, you're not going to get much to eat unless you put your face in the plate, rather than be able to scoop. But this is the concept. Try to make maximal use of that affected hand. Other things that you want to be able to do is keep upping the ante in terms of that practice. So reaching for that cup a little faster, reaching for that cup a little higher than it was, reaching for that cup outside your workspace, reaching for items that are in and around your area of activity. When it comes to walking, what you want to do is continuously try to increase how safely you walk, how fast you walk, and the distances that you walk. We hear about robotic devices to assist us in movement, I'd like to show you a couple of robotic devices that are out there for use of the arm or for walking. These are two commercially available robotic systems for primarily moving the shoulder and elbow, where you use the arm to drive a little mouse through a labyrinth. And this is the next generation that makes use of the forearm, wrist, and fingers to carry out assisted movements using these robotic devices. This is another robotic device that assists stepping by helping to flex the hip and extend the knee. Other ways to try to improve include imagining or imaging what it is you'd like to do. So if you think about the Olympics, when you watch the swimmers, they're standing on that diving board and you see their bodies make little twitches, they're concentrating, they're really running through the dive, all the movements in their minds before they make the dive. Dancers do that. All skilled athletes imagine the situation and how they're going to respond to it. You can do the same thing because that uses the same networks of nerve cells that you would use to actually practice. And so in a sense, you're increasing the activity within those nerve cells, strengthening synapses merely by thinking about reaching or thinking about your walking or thinking about your speech. And so that's an interesting strategy to work on with your therapists and your family. There are a variety of other things that have been used, like electrical stimulation or transcranial magnetic stimulation. These are methods that help try to drive the electrical activity within the nerve cells that you're going to try to use to make a movement. And in a sense, that may strengthen those movements. These work a bit if you're fairly highly functional. You know, you can already do a fair amount with your arm. It may improve the rate or degree of improvement beyond that, but they're not so good if you're quite impaired. There's a lot of research that yet needs to be done in this field. One of the things that you can do, though, that's very simple is you must always try to improve your strength. Whether working with light weights or working with elastic bands, you want to improve the strength not only on the affected side, but on the unaffected side. That unaffected side now is carrying a lot of the energy cost, a lot of the carrying power that your affected side had once done. And so you need to be even stronger. And so you want to work in sets of repetitions of increasing resistance over time. And your therapist can give you hints about how to do that. That's a lifelong activity. Another lifelong activity is increasing your level of fitness or conditioning. Almost everyone in the first couple of weeks after a stroke becomes highly deconditioned. It's remarkable how fast your muscles waste and how much harder your heart has to work just by being in bed rest, just by not being able to do the ordinary activities that keep you fit. And so as soon as possible, you want to try to increase your fitness. How can you do that? Well, if you're able to walk, then walking over ground, gradually walking on a treadmill, increasing your walking speed and duration of walking can help you do that. If you have access to a recumbent bicycle, that's a nice way to use the big muscles of the thighs and buttocks to be able to increase your heart rate, get a little bit shorter breath, and be able to improve your fitness. The more fit you are, the less is the energy cost for doing your walking and doing your activities, despite the fact that you still have some residual weakness. And of course, fitness training and strengthening also reduce your risk factors and help you manage your diabetes and your high blood pressure and your blood lipids. So it makes good sense for your overall health to do that. From time to time, I have a patient who shows up in my office and says, "Doc, I need those stem cells. I'm not as good as I want to be." And we have a conversation. What do we mean by stem cells for stroke? Well, the reality is that there is, at this time, no valuable, no useful, no proven way to use other cells, whether they're from an embryo, whether they're from an adult, whether they're from bone marrow, to be able to reduce the amount of tissue injury or to be able to enhance recovery of function. We're getting there. But unfortunately right now, there are stem cell sellers who live offshore, promise you the world. They give you cells that you will not understand at all because the scientists like us do not understand what they're using. They may inject them into the spinal fluid, they may inject them into the blood, they may inject them directly into the brain. The reality is that they have not done any studies to show that this is of any value. Now that doesn't mean they can't charge you $10,000 to $25,000 a shot for this and promise you that you'll get better. But when we see people who go and do these interventions, one of the remarkable things is that they always come back home and do a lot more physical therapy again. You know, they've gotten depressed, they stop doing their therapy, and they get better, probably simply because in little ways they're practicing more, they're doing things that are goal-oriented, and they're improving a tiny bit and getting better. As far as we know, there is no benefit to any stem cell intervention, and you should not consider a stem cell intervention unless it's part of a clinical trial in which people are randomizing patients or doing serious safety studies within university settings with reputable researchers.